Hi, I'm Dr. Edwin Williams. I'm a rhinoplasty specialist based in New York, and what I'm going to talk about in this fireside chat is the big debate over open rhinoplasty versus closed rhinoplasty. And I'm passionate about rhinoplasty, and I've been doing it for 23 years. I initially went through my fellowship training because that was the primary focus and in my interest, being double board certified in ENT and head and neck surgery first, and then facial plastic surgery second. It was a natural interest of mine. So what I want to tell you is I think it's important, in order to understand the difference between open and closed rhinoplasty, it's important to understand the history. So I don't want to bore you here, but I do want to talk a little bit about the historical perspective. The first rhinoplasty was done by Dr. Orlando Rowe, and that was in Rochester, New York. And he wrote this article called Correction of a Pug Nose. And that was really the first ever described rhinoplasty. So doctors tried throughout the country and even in Europe to reduce the size of noses for years. And around the 1970s, there was this movement because a lot of rhinoplasties were what we call a reductive rhinoplasty, tissue being taken out, taking the bump down, trying to thin things out. And what we learned in the 70s by a lot of the doctors doing surgery at that time was that it was just a little too aggressive. In other words, if you think about the nose as having cartilage and framework, if you thin that out too much and you take it down too much, you can turn the nose, you can take down too much of the profile, but more importantly, you can end up with structural or breathing problems, especially long term, because of what we call the scar contracture effect. Think of shrink wrap pushing down as we heal, and it's fighting the forces of cartilage. And if there's not sufficient cartilage there, then we end up with issues, breathing problems and what have you. So at that time, right around the 1980s, one of our giants the giants in our field, and one of the forefathers of our specialty in rhinoplasty, was Jack Anderson and Calvin Johnson. And both of these guys were very, very instrumental in talking about overdone rhinoplasties. So what they did is they started with a new movement called the open structure rhinoplasty. And what that really came down to was a way to open the nose and take cartilage from the inside of the nose and rebuild that nose. And that was very, very, very popular and very well received in the 1990s, moving into the 2000 timeframe. At that point, what they really did, it was they stressed not conservatism and structure. And because of this wide movement, this moved into the training programs. And all of the doctors learning how to do rhinoplasty, not only is it a fun operation to do if you're passionate about it, but it allowed you to see more. You made an incision, and I can show the incision actually. This is in our book, and I can go through this in a bit, but there's an incision that goes through the inside of the nose and opens across the base that allows us to open the nose, not unlike the hood of a car, and see what we're working on. So what they did is they stressed that, and that is what was emphasized in the training programs. Now, because of that, there are more and more and more doctors in the States that open the nose. There are advantages and disadvantages compared to the closed technique. The closed technique, which was done in the 1970s, was not to open the nose, but to do all of the incisions on the inside of the nose and take down that profile and thin the tip out. So there are advantages and disadvantages. Now, what many of us, I was very fortunate because I trained, one of my mentors opened every nose, because I was right around that time frame, the early 90s, and one of my other mentors didn't open any noses. So I was very fortunate to be exposed to a high volume of surgery where the noses were opened and the noses were closed, or done closed. What I became acutely aware of was how important it was to maintain structure to the nose. And so I think that the older techniques of closed rhinoplasty were unfairly labeled as reductive rhinoplasty. In other words, taking too much tissue out. There's been a movement of a few of us that now believe that yes, the structure is very, very important, but if we can take and rebuild that structure without opening the nose, that's a good thing. So let me just talk a little bit as I finish up about the open versus the closed approach in this day and age. There are some advantages and disadvantages. If we open the nose, especially for those that have a lot less experience, It's easier access. There is a downside, though. With that, by taking the nose all apart and opening it, there is definitely more in the way of recovery. More bruising, more swelling. It takes longer to do, and you have that incision. Now, in all fairness to those who are advocates of the open approach, this incision, and by the late 90s, 2000 timeframe, I was probably opening 50% of my noses. That incision can be healed up very well, and I can tell you, because I have patients in mind, it's barely perceptible. The bigger issue to me is the recovery and taking the nose apart and the long-term healing that goes along with that. I believe that long-term results with an open rhinoplasty come many years down the road because you're taking things apart and putting them together again. Some people feel they can get better results with opening the nose. My personal opinion at this point is that the endonasal or closed approach, taking structure into consideration and rebuilding with cartilage, is technically more demanding. And it's very intimidating for those who have not been exposed to the endonasal or closed, or what we refer to as the scarless approach. What I also like about the endonasal or closed approach is the recovery period. Most of our patients have 2 to 4 days of bruising. 90% of patients come back at a week and have very little or no bruising. It does, when it's done, you don't have the outside incision, which that's why they refer to as scarless. And in my opinion, and now we have some structural data to show that long-term results are achieved much more quickly with the endonasal approach. I think it makes perfect sense. When you're not taking the nose all apart, you're going to get it's a less invasive procedure and easier recovery for the patients. The other thing we're seeing now is because so many people were trained on the open approach, is that there are more and more severe revision procedures being done on patients who have had the open approach. So I know this doesn't answer all of your questions. We do have a lot of questions that are answered. There's a whole section on frequently asked questions in our book, Rhinoplasty, Everything You Need to Know About Fixing and Reshaping Your Nose. It's on Amazon. But again, I think that both approaches are acceptable, but in my hands, about 98 to 99% of our patients we will do through the endonasal, closed, or scarless approach of rhinoplasty. So I hope you found this video useful, and thank you for watching.